Hello guys, let me introduce myself. My name is Husnul hotimah. My student number A1B219049, and at this video I will talk about anxiety disorder. I'm from R002 English Education Study Program, University of Jambi, and let's check it out. First, what is social anxiety disorder? We all know of the feeling being nervous or uncomfortable in a social situation. Maybe uh, you have claimed when meeting someone new or gotten sweaty before making a big presentation, uh, public speaking, or walking into a room full of strangers. It's not it's not exactly thrilling for everybody, but most people can get through it. Uh, if you have special anxiety disorder, the stress of the situation is too much to handle. You might avoid all social contact because things that other people consider normal, like making small talk and eye contact, uh, make you so uncomfortable. And next, when does it happen? Anyone with social anxiety disorder can experience it in the different ways, but uh, some common situation that people tend to have trouble with, like uh, talking to strangers, speaking in public, using public restroom, go to school or work, or starting conversation with other people. Uh, some of this situation might not cause a problem for you. For example, giving a speech may be easy, but going to a party may be a nightmare. Or you could be great at one-on-one conversation, but not at stepping into a crowded class. All social anxiety people have different reasons for reading certain situation, but in general, it's not overwhelming fear of like being judged by others in social situation, and second, being embraced all or humiliated and showing it by blushing, sweating, or shaking. And next, what does it feel like? Uh, the experience may be different for everyone, but if you have social anxiety and you are in a stressful situation, you might have physical symptoms like uh, quickness, heartbeat, muscle tension, dizzy, stomach problem, or shortness breath, and other. You may start having symptoms and getting anxious before an event, or you might spend a week worrying about it. Afterward, you could spend a lot of time and mental energy worrying about how you acted and what caused it. There is no one thing that causes social anxiety disorder, but genetic likely has something to do with it. Um, if you have a family member with social phobia, uh, you are more at risk to having it. Uh, you are more risk to having it too. It could also be linked to have an overactive amygdala. Um, amygdala the part of the brain that control your fear response. Mm, Usually, social anxiety comes on at around 13 years old. It can be linked to history of abuse, bullying, or teasing. And cases because job. Uh, Finding a job that you enjoy and that you feel comfortable doing can be challenged if you live with social anxiety disorder. Uh, Often your choice of job will be dictated by uh, how far along you are in terms of you are how far along you are in terms of diagnosis and treatment. People who have successfully managed to overcome and learn to cope with symptoms of social anxiety uh, are better for positions that are socially demanding. And at the same time, people with people with social anxiety disorder are often suited to particular types of jobs, regardless of how well they have learned to cope with social anxiety. And there is some job suited to people with social anxiety, like writer, artist, drug trainer, accountant, computer programmer, and other. And the next, how is social anxiety disorder treated? Uh, First, talk to your doctor or healthcare professional about your symptoms. Your doctor should, should do an exam and ask you about your health history to make sure that an unrelated physical problem is not causing your symptoms. And your doctor might refer you. Uh, uh, your doctor may refer you to a mental health specialist like psychiatrist, psychologist, clinic social worker, or counselor. The first step to effective treatment is to have a diagnosis made, usually by a mental health specialist. Social anxiety disorder is generally treated with psychotherapy, sometimes with medication or uh, both uh, psychotherapy and medication. Speak with your doctor or healthcare provider about the best treatment for you. And there is no way to predict what will cause someone to develop an anxiety disorder, but you can take steps to uh, reduce the impact of symptoms if you are anxious. Like first, get help early. Anxiety, like many other mental health conditions, can be harder if you wait and not consult to the doctor get, or have a special treatment. Second, keep in journal. Keeping track of your professional life can help you or your mental health professional identify what's causing you stress and uh, what seem to have what seem to help you feel better. And third, prioritize issues in your life. You can reduce anxiety by carefully managing your time and energy. Make sure that you spend time doing things you enjoy. And the last, avoid unhealthy substance like alcohol, drugs, even caffeine or nicotine can cause or worse anxiety. If you are addicted to any these substance, uh, quiet can make you anxious. If you can quiet on your own, see your doctor or find treatment program or a support group to help you. And I think that's all from me. Thank you so much for watching my video. I'm so sorry, uh, all of my mistake, and see you.